Morning and welcome to today's virtual media conference to apprise you of government's efforts to combat COVID-19. Today with me are the Minister of Health, the Honorable Terrence Deyalsingh, the Chief Medical Officer, Dr. Roshan Parasram, and Dr. Marlon Rampal, Consultant in Internal Medicine and Infectious Diseases at the Eric Williams Medical Sciences Complex. The Minister of Health, the Honorable Terrence Deyalsingh, will provide an update on COVID-19 in Trinidad and Tobago.
Yes, thank you, Minister Cox. Good morning to ladies and gentlemen of the media. Good morning to the Chief Medical Officer and Dr. Marlon Rampal. And finally, good morning to citizens of Trinidad and Tobago, wherever you are, viewing and listening. So as usual, I would like to give you the global perspective as to where we are in this global pandemic. The total number of cases around the world, 3,330,772 as we sit here this morning on Friday, the 1st of May. Total number of deaths recorded globally, 234,768. We are closing in on the 250,000 mark in terms of deaths globally. Those who have recovered, 1,053,256. With each passing day, a new country or territory is added to the list. It seems as just yesterday we were mentioning 190 countries, then 200. Today it stands at 212 countries and territories around the world and 2 international conveyances. That relates to issues like cruise ships. So 212 countries around the world and territories, including 2 international conveyances. Where are we in Trinidad and Tobago with our local situation? The total number of tests done to date, 1,772. Total number of unique patient tests, 1,452. Total number of repeated tests, 320. As you may recall, we started a program of community testing. To date, we have tested 304 persons in the community, and to date, all 304 tests have come back negative. Before I hand over to the Minister, there's one other issue that I would like to address, and that is why Dr. Marlon Rampal is here this morning. At the Ministry of Health and the Ministry of Social Development and Family Services, we are particularly concerned with our elderly in the long-stay homes. And we continue to have dialogue with the association and Ms. Caroline Diaz in particular. I would like to thank Ms. Caroline Diaz and her association and all her members for working with both ministries. We have a committee specially set up to assist them, to train, and that is being done under the policy framework we have, because we recognize that in these homes, if you look at what is happening globally, these long-stay homes were the most vulnerable stay in terms of age, medical condition. We want to make sure that we protect these people as far as humanly possible. And Dr. Marlon Rampal is here this morning to focus on how we could work together as we have been working, and I want to congratulate them again, how we could work together with the owners and administrators of these homes to keep this most vulnerable population as safe as possible. So I look forward to that. Thank you very much, Minister Cox, and over to you.
Thank you very much, Minister. At this time, the Chief Medical Officer, Dr. Roshan Parasram, will provide us with a clinical update.
All right, good morning, honorable ministers, members of the viewing and listening public. So to continue on the clinical update for Friday, the 1st of May, 2020, we're looking total number of persons that are positive remain at 116. The total number of discharges have gone up by 1 to 73. Total number of deaths remain at 8, 7 for Trinidad and 1 for Tobago. Total number of new hospitalized patients over the last 24 hours, nil. Total number of hospitalized patients at the Couva facility, there are 6 persons there. In the Cora facility, we still have no new or no positive patients in that facility. Within the Couva facility, as I said, there was 6. There's no one in ICU. There's no one in HDU. All of them are within the regular wards. In terms of Sandy Grande, the Brooklyn Center, where we have convalescent patients, there are 8 persons still in that facility. In the Home of Football, which is another convalescent facility, there are 21 persons housed there. As you know, the quarantine facility at Tacarigua has 33 persons to date. We expect in a short while 70 persons to come in from Suriname. They will be taken to the Penal Debe campus of the University of the West Indies. So they will be coming in very shortly. I visited myself yesterday to assure everything was in place. So the county medical officer is the commander on the Ministry of Health side, and she's already on site, assured me that everything is in place to receive these nationals when they do come in. By way of testing, in terms of our satellite site at North Central, that is now up and running fully. I would like to say that as of Sunday, the testing capacity was there at that site. Sunday the 26th, I believe. So we were ready and willing to test. We got a panel from CAFA on the 26th, which we ran as a quality assurance panel. The results were good, but we held a little bit because I don't think the results were 100%. We would have repeated the panel between Tuesday and Wednesday, and we got the word from CAFA that everything is all well. The results are very good, and we have started to receive samples at that site as well. So, Minister Cox, that's my clinical update for today.
Thank you very much, Dr. Parasuram. Dr. Marlon Rampal, consultant in internal medicine and infectious diseases at the Eric Williams Medical Sciences Complex, will now speak on the rationale applied to the use of personal protective equipment, PPE, within healthcare institutions. Dr. Rampal.
Thank you. Good morning, honorable ministers, CMO, members of the media, and the viewing and listening public. So there's been a slight refocus. I would like to actually gear my topic today towards infection control and prevention strategies in homes for the elderly, nursing homes. So as the minister mentioned before, this represents a very important area because this population is a vulnerable, high-risk population. So it's essentially imperative to ensure that we do not allow COVID-19 to spread within these facilities. The Ministry of Health has a policy in place that details the necessary infection prevention and control strategies that need to be employed to limit transmission of COVID-19 within these nursing homes. I just want to touch on some of the important elements of these policies, and in particular, 2 main concepts. The first concept has to do with keeping COVID-19 from entering the facility in the first place, and the second concept has to do with identifying infections early and taking the necessary actions immediately. So on my first point, keeping COVID-19 out of these facilities, what needs to happen? First of all staff employed at these facilities need to be aware of the policies to limit transmission. All staff needs to wear a surgical face mask or, if not available, a cloth face mask when reporting to work. These nursing homes should have a system in place to check the temperature of all staff and visitors entering the facility. If anyone has a fever, they should not be allowed to enter, and they should be redirected to a healthcare facility for further evaluation. Family visits should be restricted as far as possible, and to this end, alternative methods of communication such as video conferencing could be employed. If family members need to visit, then they should wear at least a cloth face covering. Access to non-essential staff need to be restricted, and all of these facilities need to have things in place to allow for continued practice of hand hygiene. And this simply means ensuring that there are hand sanitizers at the point of entry and at strategic locations within the facilities. And of course, as is important elsewhere, social distancing within the facilities needs to be enforced. And this may take the form of ensuring that the beds are adequately spaced, at least 3 feet apart, but ideally 6 feet. And if possible, ideally patients should be kept in separate rooms. If any resident does develop any symptoms that may be suggestive of COVID-19, and these may include any respiratory symptoms, fever, cough, sore throat, shortness of breath, then they should immediately be given a surgical face mask and quarantined in a separate room. In addition, all staff entering that room to take care of the resident need to ensure that they have on adequate levels of personal protective equipment. This usually would entail a gown, gloves, surgical face mask, and eye protection. And it's important that the county medical officers of health for the particular area are informed immediately so they can visit the home, evaluate the patient, and take the necessary steps. Now, why did we decide to focus on this particular group today? Well, we know, and we've mentioned before, that there are particular groups of patients, if they become infected with COVID-19, are at a higher risk of having a poor outcome. And the elderly are a significant component of this high-risk group. So all of the measures we have taken so far to limit transmission of COVID-19 in the community, all of this could be for naught if we allow COVID-19 to spread within any of these nursing home facilities. The number of cases would go up quickly, and these would all be very sick patients that may require HDU, which is a high dependency unit, or ICU, intensive care unit care. They are more likely to require intubation and mechanical ventilation, and sadly, they are also more likely to have a poor outcome and may die. We have learned from what has happened across the world, and if we look at the situation in the US, early on, certain states, in particular Washington State, had reported spread of COVID-19 within nursing home facilities, and the results were catastrophic, with rapid spread and several deaths. Most recently, in Massachusetts, there was a report of a nursing home that cared for veterans, and 70 of these veterans died within this facility, which is devastating to think about. And to put things in perspective as well, in Maryland State, overall, they had approximately 700 COVID-19 cases, and approximately 400 of these originated within nursing homes. So there's this concept now of the nursing home potentially being an epicenter, so to speak, of COVID-19 outbreaks and spread. So the Ministry of Health has established committees that have been tasked with evaluating these nursing homes, ensuring that they are all aware of the policies that need to be implemented for effective prevention of infection and spread, and to ensure that they are all taking the necessary steps to limit this transmission. I also wanted to touch briefly upon some basic infection prevention strategies that are in place at the healthcare institutions to limit spread of COVID-19. So what's done at the initial point of entry through the healthcare system, which would usually be through an accident and emergency department, there are screening and triage systems in place. What this simply means is that there are systems in place to identify patients immediately at the point of entry to determine which patients may have any respiratory symptoms, which would be fever, cough, shortness of breath, sore throat, or any other symptoms that may be suggestive of COVID-19. Once these patients are identified, the next step is source control, which again simply means placing a surgical face mask on these patients. The next step is to direct them to a separate, dedicated area of the hospitals or the healthcare institutions where they will be further evaluated. And this represents the first point of divergence in the healthcare system between the normal healthcare system and the parallel healthcare system that has been created to specifically care for suspected and confirmed COVID-19 cases. The reason I wanted to bring this up is in other countries we have seen the phenomenon of patients being afraid to go to the hospitals because they are concerned that they may be exposed to COVID-19. This has resulted in patients dying of heart attacks and strokes at home just because they're afraid to access healthcare. And the systems we have put in place are such that the public doesn't have to worry about this happening. As I mentioned, we identify patients with suspected symptoms at the point of entry, and they are separated to a separate pathway. So if you have any symptoms and you feel that, if you have any symptoms in terms of chest pain, any other types of symptoms not related to COVID-19 and you need to access the healthcare system, please do so. And I just lastly wanted to touch upon what's called the rational use of personal protective equipment within the healthcare systems. This is called rational use because we're trying to accomplish different things at the same time. On one hand, we're trying to limit exposure of the healthcare workers, so we're trying to protect them, but at the same time, we're trying to conserve the personal protective equipment, so in the long term, we don't have shortages and we don't run out of them. So personal protective equipment simply is worn by healthcare workers in the management of patients with certain infectious diseases to prevent them from becoming exposed. The type of personal protective equipment required varies based on the type of infectious disease and the level of exposure. In the context of COVID-19, the basic personal protective equipment consists of gloves, a gown, a face mask, and eye protection, which may be in the form of goggles or a face shield. In terms of the face, so this is the first slide, and it simply shows the eye protection, in this case goggles, the face mask, the gown, and gloves. In terms of the face mask, there are two types that are commonly used in the medical setting for COVID-19. These are, on top, we see the surgical face mask, and underneath, the N95 face mask. So I just want to make the point that these types of face masks should be limited for the healthcare setting for medical personnel managing patients with suspected or confirmed COVID-19. Even within this setting, there may be some confusion as to which mask to use and when to use it. And the explanation lies within the method of transmission of COVID-19. And there has been some debate as to whether this transmission occurs mainly via the droplet route or the airborne or aerosol route. So what do I mean by this? So the basic difference between droplet and airborne transmission could be explained in terms of three simple concepts: diameter, distance, and duration. Let's focus on droplet transmission first. So droplet transmission occurs via larger particles, larger diameter particles that travel a shorter distance and do not remain suspended in the air for as long a duration. So as they are expelled via a sneeze or a cough, they travel a small distance and they fall to the ground, fall to surfaces. So we see this highlighted by the large blue dots. So typically, we see the larger diameter traveling a shorter distance and typically within 3 feet. But smaller droplets may be produced that could travel as far as 6 feet. This is why the general social distancing recommendation is to maintain at least a safe distance of 6 feet. Now, when we compare this to aerosol transmission occurs via smaller particles, smaller diameter, that travel a further distance, easily beyond 6 feet, and remain suspended in the air for a longer duration of time, maybe as long as 3 hours. So how does this tie back into which type of face masks need to be used? Surgical face masks are adequate for droplet transmission. N95 masks need to be used for aerosol transmission. This is because the pores in the surgical face mask are too large to prevent the penetration of the smaller aerosol particles, which the N95 mask could prevent. In terms of COVID-19, the main mode of respiratory transmission is thought to be droplet transmission. So therefore, the surgical face masks are adequate. However, having said that, there are certain clinical scenarios in which aerosols, those smaller particles, may be generated. These are called aerosol generating procedures. And it's only for these specific situations an N95 mask may need to be worn to afford an extra level of protection to the medical personnel. And this last slide just shows a few common aerosol generating procedures. Well, if it's taking that time, okay, good. So I mainly just want to focus here on two things: nasopharyngeal swab testing, which is basically the method of collection of swabs to test for COVID-19; intubation, which refers to placing a breathing tube into someone with respiratory distress who may need to go on a ventilator; and cardiopulmonary resuscitation. So 3 main ones. So for all these procedures, as well as the others on the list, healthcare workers in these situations will need to wear an N95 mask. Outside of this setting, the regular surgical face mask would be adequate. So these concepts provide the framework for determining the level of exposure, level of risk for healthcare workers, and therefore which PPE is required. So to summarize, for non-aerosol generating procedures, gown, gloves, eye protection, and a surgical face mask. For aerosol generating procedures, gown, gloves, eye protection, and an N95 face mask. Thank you.
Thank you very much, Dr. Rampal,
Really good.
for your very interesting,
it was.
informative presentation. Actually, the part about taking care of the elderly resonated with me, having an elderly mom at home to take care of. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the pool and time allows, I will come back to you. So let us keep this in mind as we begin taking your questions. 91.9.
Right. Hello, good morning, everyone.
Good morning.
91.9 FM Street. I just want to guide the conversation in a particular direction to question the cruise ship industry a little bit, especially as we have that we have Dr. Rampal here. In particular, the cruise ships are one of the main focus points of any tourism industry, and especially in Tobago, we've been trying to ramp it up. What I wanted Dr. Rampal to advise on is how is that risk of transmission on a cruise ship, especially with diseases like COVID-19, and also maybe if the minister and the CMO could come in as well and chime in on what particular policy we may put in place moving forward past this. We all see that the cruise ship industry will be a viable option for tourism coming out of this situation, looking at the medical risk involved on people being on cruise ships and the rates of infection and that kind of thing. I just want to get some insight on that, as cruising and cruise ship passengers are one of the main sources of income for tourism in Tobago. Thank you. Good morning.
Thank you.
So just to,
The CMO
yeah,
will go
just
first.
to start off and then I'll pass it to Dr. Rampal.
Okay.
Basically, cruise ships were noted even before COVID to be a sort of environment where you may have a high risk of infectious disease present. Our policies and procedures would have been rigorous to some extent on the cruise liners, but they're definitely, after COVID, there's definitely a change that will have to happen. So we would have been looking, for instance, at gastroenteritis as a disease that would have been present throughout the industry for quite a long time. Our policies would have said that even understanding there was always a low level of transmission of something like gastroenteritis aboard a cruise ship, and policies granting pratique and the like, which is granting the ability for persons to come off a vessel and come on land, was benchmarked across 2%. So if you went above 2% of persons having gastroenteritis, we use that as a sort of guide to say that you weren't granted pratique. So the environment itself, because of the close quarters, because of the way the cabins are built, it is an actual area that you would find high levels of infectious disease being present. Post-COVID, and seeing that this new pathogen is being spread vigorously in that environment as well as others, there needs to be a change in the way, one, screening is done aboard the cruise ship. So persons coming onto the cruise ship, of course, will have to go through a much more rigorous screening process. The sanitization aboard the ships will have to be, again, in a more rigorous fashion. So COVID-19 has changed the way we do a lot of things, and the cruise ship industry is no exception to that rule. So Dr. Rampal, if you want to expand a little bit.
Thank you. Well, I think you touched on some of the important points, but just want to say, as soon as I heard the term cruise ships, my heart started to race and my stress levels went up. Cruise ships represent an extremely high-risk situation in terms of spread of COVID-19. And to put things in context, the World Health Organization puts out what's called a situation report on a daily basis. And this details the different countries and the number of cases that's in these different countries. And in this list, which is mainly made for countries, there's a separate section for a cruise ship. I think it's the Diamond Princess cruise ship, where there were a rapid spread of a large number of cases of COVID-19. And the reason for this is these cruise ships represent a fertile ground for spread of infectious diseases, and COVID-19 is no exception. What some of the reasons for this, the CMO touched on, is that it's difficult to limit social distancing because there's a lot of people in very confined spaces, and this facilitates the rapid spread of infectious diseases like traditionally gastrointestinal diseases, and now we're seeing COVID-19. So as the CMO mentioned, moving forward, the cruise ship industry and other businesses, industries in general would need to rethink the way they deal with their clientele. And this is all what's being termed as the new normal. And we will have to see how these things play out in the near future.
Thank you very much. 98.1.
Good morning, everyone.
Morning,
Stephen
Mr. Cummins.
98.1 FM. A question for Minister Deyalsingh and one for Dr. Parasuram. I start with Minister Deyalsingh. Minister, in its contribution and in an effort to help speed up international research development in the race for COVID-19 vaccine, the World Health Organization, would you say that Trinidad and Tobago would be contributing to a fund which was launched, which will be launched on the 4th of May 2020? There's an initial target of an estimated 7.5 billion euros in capacity funding. So the question is, would Trinidad and Tobago be contributing to that fund? And Dr. Parasuram, is there any component in our local response that is strongly being implemented on patient recovery? A special component that would help us deepen the data collection statistics, which will allow us to better understand recovery timelines, why persons recovered, and how those persons were able to avoid prolonged infections of the COVID-19 disease.
Okay, so thank you for the question, and I'll go first. Any request from a member state to PAHO for funding, there's a path that needs to be followed. WHO will contact PAHO. The contact or focal point for PAHO in Trinidad and Tobago is the Chief Medical Officer, and then that comes to me. As we sit here right now, I have received nothing from the Chief Medical Officer, who is the focal point for matters to deal with this. If and when it happens, we will handle it at that point in time. Thank you.
Dr. Parasuram.
Okay, so I don't know if I got that question clear, but I'm looking at patient recovery, yeah? So our numbers as if you take the cruise ship, and even if you use the cruise ship data, is pretty small in terms of recovery. So when you talk about clinical recovery, we're speaking about offering psychological support, offering physiotherapy as it relates to lung health, because we have seen in other parts of the world there's an issue with fibrosis of the lung, and even following the lung disease, there's a little bit of decrease in lung function, as we see something called the forced expiratory value decreasing in some of the patients, meaning that their lung capacity is reduced post-infection. So by looking at those two areas, paying attention, we're looking at the recovery phase. But I think your question is broader than that and speaks to whether we're looking at the data to see if there's something jumping out of at us in the recovery phase that is different. And I think the answer is no. In the early stages that we saw these cases recovering, most of them have been able to recover and go back to their normal way of life completely. The rigorous discharge criteria that we use in terms of having your double negatives and, of course, waiting a significant amount of time after you're symptomatic gives us a little added benefit or added reassurance that, as Professor Carrington would have explained yesterday, there's a possibility of getting a positive after negative. And we reduce that significantly by waiting that long to test and then testing with a double negative. So I don't know if that covers your question.
Thank you, Doctor. TV6.
Good morning.
Morning.
Good morning.
Good morning. Elizabeth Williams, TV6 News. What I wanted to do first is to thank Minister Terrence Deyalsingh for bringing the issue of fire officers in Tobago to light. There was a situation that I would have brought to Minister Deyalsingh with respect to the fire officers in unsanitary conditions in light of COVID-19 at Crown Point, and the matter has since been addressed. Thank you so much, Minister.
Well, I did mention the issue
There
of
are
national
two
security, so the
issues
thanks
that I
goes to
have.
him.
I don't know if Minister Deyalsingh
Sure,
could also pass on the information for me.
sure.
Nationals in the UK are concerned. They are saying that they have been trying to visit the High Commissioner office in the UK, but no one is there. The gates are locked, and also when they are calling the various numbers, they are not getting through. Also, my second question is any special arrangements to treat with the visually impaired? A number of persons who are visually impaired would have contacted us and are wondering, in light of COVID 19, what measures are being put in place to assist them since they don't have any caregivers, and some also in terms of online classes, what is being put in place to facilitate them?
Okay. Thank you, Elizabeth. I will certainly pass on the information to the Ministry of Foreign Affairs to deal with the issue of nationals in the UK. I will give you my word, I will do that today. Thank you.
So I know the matter of the visually impaired has been dealt with through the offices of the CMOHs. As I said before, we have 8 in Trinidad and 1 in Tobago. So they are aware of the issues and they are trying to deal with it from their local levels. By way of online classes, I'm not sure that they have reached that far in their deliberations, but in my interministerial committee, there's a member from the Ministry of Education, and I will certainly raise it with her on our weekly meeting that we have.
Thank you, Doctor. Express.
Good morning, Camille Hunt Express. My question is for the CMO. Dr. Parasram, there was an AP report some days ago that spoke about the effects of COVID-19 on different ethnicities in the US. And it said African Americans seem to be more susceptible to the virus. So I'm wondering if we have any data on that as it pertains to TNT, meaning have we seen one ethnic group being more affected than another? And also I wanted to get an update on the hotlines just to know if people are still calling and coming forward to be tested.
Okay, so I will start out the discussion on the first part and limit it to the Trinidad and Tobago context. It's not a theory, there is very sound evidence that supports something called the social determinants of health. What it basically means is this: in any society, people engage in health-seeking behaviors and are more or less healthy depending on your socio-economic condition. It's a fact. Globally, people in the lower socio-economic conditions carry the brunt of all major diseases, whether it's NCDs, infectious disease, for a variety of factors. Educational attainment, income, geography, population density, and so on. So I will not be referring to the United States. I will simply say in any country, you will notice that COVID, diabetes, hypertension, any disease will be disproportionately found in people where they live in lower socio-economic conditions. It's a fact of life, and that's why we reach out to them as a special population to get them to engage in what we call health-seeking behaviors through workshops, community meetings, having our free health screening days for cancers in our hospitals and so on, to encourage them to come forward and volunteer to be advocates for their own health. And I'll now pass you over to the CMO.
Yeah, so in terms of the hotline part of it, there is a report that is generated, normally goes to the corporate communication unit to see what types of calls. There has been a great reduction in the number of calls. Overall, quite a large reduction in the number of calls we have been receiving. So I can get access to the report if you all require it and go into further detail. But generally speaking, there's been a significant reduction in the number of calls we're seeing over the last week or so. And calls are really streamlined and more related to febrile illness. The number of febrile illnesses, which is something that we call acute respiratory illness in this country, has dropped significantly over the last 2 weeks. It's a combination of things. Less people visiting the facilities, one, as well as because we have, through the month of April, been more stringent in terms of public health guidelines, hand washing, sanitization of surfaces, and all the other public health measures, wearing masks, we actually saw a significant drop in the number of acute respiratory illnesses. For the week before this week, we would have seen a total of 67 acute respiratory illnesses, which is a surveillance category for the entire country, which is less than 10 people per day presenting. Now, acute respiratory illness is generally a disease that in this country will affect anywhere between 100 and 120,000 people every single year. These are what we call the common cold. This is what's commonly known as the common cold. So about 1/10 of our population every year will have the common cold. Some people once, some people more than once. Over the last week, as I said, we have had 10 cases per day, which is far below the national average for the last week, and even the weeks before that, we have seen a significant reduction in acute respiratory illness, in influenza, in gastroenteritis as well. So there's significant decreases in those levels, and the calls that we're getting in terms of reduced number is somewhat related to the decrease that we're seeing in those illnesses.
Thank you very much. AZP News.
Good morning, Errol Fabian representing AZP News and Gael Limited. Good morning, ministers.
Good morning.
Confirmed cases number 115 and 116. Can we know if these are imported cases or community spread? And was it proper hiring procedure followed with respect to the newly appointed general manager operations at Cora with respect to COVID?
Okay, so I can take the first question. From cases 115 and 116 seem to me to be local spread, to the most part, meaning that they are not acquired in any other setting. So from our epidemiological search, they are seeming to be local spread, meaning within Trinidad, not from an imported source. We have our key goal for those cases is really to ring fence those cases as quickly as we can, which we have done. So we earmark primary, secondary, and tertiary contacts, and we hope that no hidden contacts are out and about with disease emanating from those sources. So the epidemiology unit, together with the county medical officers of health, one for St. George Central and St. George West, are working to isolate those cases. They will do so for 14 days and they do daily fever checks as well as symptomatology checks. If they get any of them showing symptoms, they will test as well to make sure that they're not getting COVID on their own. And so we are actually trying to prevent cluster formation at this point with those two particular cases. So we still listed as sporadic because our cases are sporadic, but they seem to be local. And really containment is where we are at. Actually, one of the cases we would have gotten just before the 27th. And that's why we need 14 days from every particular local case to see if there's a cluster generating. So we're really trying our best to keep that cluster, to not form a cluster, which has so far, there has been no additional cases outside of those, but we have been able to list the primary, secondary, and tertiary contacts and ensure that those people stay home together with their families so that their spread is limited.
Okay, the second part of the question, Mr. Fabian. Under the RHA Act of 1994, the RHAs own the properties and run the RHAs. The Minister of Health does not engage in hiring, recruitment, or selection. If there's any question to deal that you need to contact the Chief Executive Officer of the North Central RHA, Mr. Davlin Thomas. I have absolutely nothing to do with hiring within the RHA system.
Thank you, Minister. Newsday.
Hi, good morning, everyone. Shane Superville from the Newsday newspaper here. My first question is for Minister of Health, Terrence Deyalsingh. It's with respect to the committees that were set up under the Ministry of Health with respect to the evaluation and assessment of long-stay homes for the elderly. Just wanted to know what is the procedure or the process, rather, that goes on behind the evaluation, what aspects or factors are considered. And my second question, also for the Minister, or perhaps Dr. Rampal may be able to weigh in, is with respect to the same elderly homes, would it be safe to say that the elderly at these homes are safer there than they are with their relatives, given the additional resources and PPE?
Okay, so CMO will answer the part to deal with the homes.
So in terms of the long-stay homes, basically they are geriatric homes that would have fallen under the Private Hospital Acts. So a lot of them would have been licensed under the Private Hospital Acts, which is an annual licensure that takes place. joint inspections by the Ministry of Social Development as well as the Ministry of Health through the CMOH is normally done annually, and a license may be issued to those homes. In terms of the upscale of response, we have a team at the ministry that actually developed protocols very early, in particular to COVID-19, disseminated in collaboration with the president of the Homeowners Association to ensure that they were, one, aware of it, and then now that they're actually practicing what is in the protocols. So my team is led by Dr. Doon. He's a health promotion specialist at the Ministry of Health, and Ms. Yvonne Lewis, and they are supported by the team at the Ministry of Social Development.
Minister?
No,
Dr.
Dr. Rampol now.
Okay.
Thank you. So the question relates to whether or not it may be potentially safer for the residents of nursing homes to be there rather than at home. I would not necessarily say that the nursing home environment is a safer environment than the home environment. I would say that within any environment, once the necessary infection prevention precautions and strategies are taken, then we could say that we could limit transmission of disease. But we have seen in confined settings like cruise ships and nursing homes, they represent situations where if COVID-19 is introduced, there could potentially be rapid spread within the facility. So I would not necessarily support the notion that the nursing home is a safer place as opposed to home. Having said that, I would understand that there would be certain limitations within households that may prevent them from being able to care for their relative at home.
Thank you. TTT?
Hi, good morning. Ian Wilson, TTT News. I want to go back to the droplets and the transmission. So I guess this question will be for Dr. Rampol. In terms of the droplets and the coronavirus, is that the coronavirus, just for clarity, would use the droplets as a vehicle to go from one place to another. But in case of the very small particles, as the bioaerosol, if I had the term right, particles, is it possible that if there's a strong airflow, whether in a building with air condition or even outside where the breeze might be blowing a bit, can the distance of transmission be even further as 6 feet? Is it possible?
So what I would say to that is, in general, we have certain infectious diseases that are primarily transmitted via the airborne or aerosol route, the classic ones being TB and measles. So for these diseases, patients who have them, they produce these small aerosol particles all the time, especially when they cough, breathe. So they travel, as I mentioned, further distances. For COVID-19, when a patient infected with COVID-19 coughs, sneezes, breathes, talks, they do not generate these aerosols, they generate droplets. So as I mentioned before, these are larger particles that travel a shorter distance. However, even then, certain procedures may stimulate the generation of these smaller aerosol particles, but these procedures typically are done in a healthcare setting. So in the public, I would not be concerned about aerosols being generated or airborne transmission occurring, at least not based on the current evidence that we have at this time.
Guardian Media Limited.
Hi, good morning. Joshua Simongo here. I just have two questions for Minister Deyalsingh. Firstly, given that there are approximately 300,000 citizens abroad and many of these people will return to the country in the coming months, is there an expectation that their arrival will bring a threat of infection that we've not seen before? And if so, are you confident that the healthcare system can manage this problem? And secondly, whenever businesses open, are there plans to put in effect more stringent food inspection measures? And in your opinion, should street food be permitted when this occurs?
Okay, so any decision to open is that of the Honorable Prime Minister. Let us say that upfront. The Honorable Prime Minister has addressed the same issue of the 300,000 persons outside, and I can refer you to his previous announcements on this. I will now hand over to the CMO to deal with the other issues.
So in terms of the food inspections that you raised, so we have a committee actually working together with new measures to be put in place if and when the food industry becomes open again. So new ways of social distancing, ensuring sanitization. So the policies and procedures are being drawn up as we speak to actually, and we are going out one-on-one as well as using mass media to disseminate the guidelines once they are complete. Basically just to let everyone know how we are to behave, both the general public as well as the employers and their employees within those settings, to make sure that social distancing, hand washing, there's a place for cough etiquette. Most critically, and I think the biggest change would be that people who are ill need to stay home. We have been saying these things for many years, especially staying at home when you're sick, but we have seen the practice being that you have a viral illness, you spend 2 days at home, you get better enough, well enough to go back to work, and you go back to work. But you continue to spread the disease, and that's where the critical part needs to change. So basically, you have to understand that if you have a viral illness, yes, you'll be well enough physically to go back to work maybe after 2 or 3 days, but you continue to spread the disease for quite a while, sometimes up to a week. In children, you can go up to 10 days. So it becomes more relevant, and the policies and procedures that we're drawing up now and disseminating to these places will speak to the changes that have to happen if we are to decrease or limit the amount of exposure that occurs.
Astronaut Health News. We are not hearing. Okay, we are not hearing Astronaut Health. Could we move to CNC3 and go back to Astronaut Health, please?
Hi, good morning, everyone.
Good morning.
Morning.
Chester Sambrano here, CNC3. To the CMO, in terms of the testing at the Eric Williams Science Center, you said that has started. Can you give an indication how many samples you expect to sample per day? And also, if you could also provide an update on the other facilities that would have been mentioned that are supposed to start testing as well, in addition to the 5 private hospitals that applied to start testing.
Right. So in terms of the facility at North Central, when I spoke to them last, they were looking at about being able or having capacity at in the first instance to 50 to 60 samples per day. As it relates to the private hospitals, we are looking at inspections have already started in terms of their labs. That should be completed, I hope, by Tuesday of next week. Once my team is able to get to all the facilities, they'll provide me, as I said, with a report thereafter. That will be shared with PAHO and CAFA so that we all can come together and agree on a way forward with those facilities.
I have a question for online, Minister.
Yes.
This person wants to know about when the persons from Suriname come in, if it means the country is going to have to suffer another 14-day lockdown.
No. The persons from Suriname will be quarantined, just as we quarantine the persons from Barbados for 14 days. So they will be quarantined for 14 days, not the country. Okay, thank you.
Thank you.
That's all
I
right.
hope the person is listening. And we go back to Astronaut News. Good morning. Are we not hearing you clearly?
Okay.
Then we will have to, let's go back to 91.9, please.
Hi, good morning. Morning, thank you very much. CMO, you just raised an important issue there about the reduction in calls that are coming into the line for persons to get tested. Could you give us some idea what is the alternative in terms of that particular surveillance testing? What will you do if you're not getting enough persons to volunteer and come forward and do that testing? What will be the next step? Could it be a situation where you mandate people to get tested, or you go into communities and knock on doors if there's a particular policy in place? And also, we want to just look at the situation of development for Trinidad and Tobago in
91.9. note at this time when we come back to you, it's one question, please. Okay, so choose which question you would like to ask so that we can get back to everyone. All right? So let us know which question you would like answered.
Well, that first one to the CMO, I think, is the more important one about the surveillance. What will be the alternative?
Thank you. CMO?
Right. So, I mean, it's a very good question. We have actually seen a significant decrease in the persons that are coming out to be tested. So, in this country, we have never. You cannot mandate someone to be tested, even if you can't go on someone's door and knock on the door and say, "Come out, and we're going to test you." There's just something that you can't do. So we rely on the persons coming out to the facilities who are ill, and then of course we are testing them at those facilities. Beyond that, and we have already expanded our guidelines. There's nothing much we can do beyond testing everyone that comes to us. From as a country, we have never gone beyond that in terms of mandating anyone, and I don't think with COVID-19 we will go that far. So if we are seeing the numbers dropping significantly, of course, innately, it will give us a sense of security that there's a decrease in the number of viral illnesses around us. Generally speaking, people who have very severe disease or moderate disease, even where they're having difficulty breathing, will come and seek care. Even if the ones that are mild staying at home, you will find that persons with moderate and severe disease will come and seek care at the facilities. And we are not seeing that. As we would have said earlier on, we saw the incidence of SARI, which is severe acute respiratory illness, being around 1.5%, which is of hospital admissions, which is generally normal for the year. So we're not seeing severe disease, we're not seeing the deaths that, in terms of spike, and Dr. Hines would have gone into length at that discussion. But basically, we are trying to sample everyone that presents that at this point, widening our definition as broadly as we can. And hopefully we will be able to pick up enough samples to continue the extrapolations in terms of analysis that we have been doing so far.
Thank you, Doctor. We take one question from TV6.
Good morning again, Elizabeth Williams, TV6. Just wanted to know, in terms of TTT employees, we have been told that state-owned TTT employees have not been paid for the last 2 months. I'm not sure if that is correct or not. And is there a problem with the finances there in terms of state-owned TTT?
Okay, I will take that one. I'm not aware of that. I'm not sure if that information is correct, but I will check on it and get back to you. It's the first time hearing this. 98.1.
Good morning again.
Morning.
Stephen, 98.1 FM. One question for the Minister of Health. Mr. Deyalsingh, I posed the question yesterday that I believe was not clearly responded to, and I had to leave it in the interest of limited time. I wish to pose it again, though. In treating with COVID-19 and future pandemics, is the use of AI or artificial intelligence and telemedicine being seen as part of our medical institutional strengthening mechanism from a government policy standpoint?
Sure. So I think that question was posed to Professor Simangal. So as far as the Ministry of Health is concerned, Cabinet approved last year, I forgot the sum of money, to start up that same thing about electronic medicine. What we want to start off first with is electronic medical records and move away from the cumbersome issue of having paper records. That is the first step we are going to take. The CMO and I were looking at the whole issue of telemedicine. He can probably expand on it. There are some advantages and there are some disadvantages. But you are probably right. With the emergence of COVID and maybe other infectious disease, this is probably a project that needs to be looked at and possibly accelerated. So maybe CMO wants to come in there and tell you what our current thinking is.
So yeah, with COVID, as you know, we set up the hotlines, which we discussed before, and they're actually manned by trained physicians. So there's some element of telemedicine in there. Of course, I have, from the start, we had a discussion with the group of physicians that would have been working in that setting, and the issue with it is that they can't give a diagnosis, a definitive diagnosis on the phone, right? Which is what happens in other countries. And there's the use of certain apps to actually disseminate results, which occurs in the UK and other parts of the world, which we have discussed. So COVID has given us a little jump start on what we wanted to do, as with many other things. So we are taking advantage of the start that we have, and we'll build on it in the coming months as we go forward.
Thank you. We move to CNC3. CNC3, one question, please.
Hello?
Yes, morning.
Yes, good morning.
Morning again. Sorry about that. I just wanted, with my earlier question, I also wanted clarification, Dr. Farstrom, about the other local facilities that will be doing testing as well. How far are we with those facilities and Tobago?
Right. So I think Dr. Nandram would have spent a lot of time actually going into that information and giving it to you all in terms of a stepwise approach. I believe the other setting that we have on the cards after North Central is Southwest Regional Health Authority. We're looking at Tobago shortly thereafter, I hope, but it depends on various factors, as you have seen with North Central site.
So from a policy perspective, the two areas we are looking at as priorities are one, Southwest, because Southwest is the largest RHA in terms of its population base. They see around 360,000 persons in their catchment area. So that is the criteria we are using. Also, why Southwest? Again, Southwest and that region carries the country's highest burden of NCDs, diabetes, hypertension. And as you saw with COVID and everything else, these are the people, the elderly, who unfortunately succumb. So Southwest will be given some priority. Tobago, even though Tobago has a smaller population, I think 60,000, because of geography and separation of the two islands by water, they have to be treated in a separate way so they could have much quicker turnaround of results. So in terms of prioritizing, after we have gotten Eric Williams up, we want to have Tobago and Southwest up and running because those are two priority areas for different reasons. One because of geography and one because of other demographic factors. So I hope that explains it.
Okay, Newsday.
Good day again, everyone. Shane Superville from the Newsday newspaper here. Just one quick question for Minister of Health Deyalsingh. This is with respect to the reopening of the country. I know yesterday you would have touched on it briefly, but I just wanted to know if you could go into any further detail on the reopening of businesses and which businesses will be phased out. Well, which businesses will be reopening in phases, I should say.
That will be a determination for the Honorable Prime Minister, as we keep saying. Let's allow the Prime Minister, who has led this country brilliantly from the start of this, the time and the space to make his very considered decision. Thank you.
Thank you. I just want to go back to a question that was asked by Elizabeth Williams, TV6, about TDT employees. This is not correct. I understand that TDT employees were paid. Salaries for April were paid, and the ones for, March was paid, and April was sent to the bank on Thursday. So this is not true at all. TDT employees were paid for 2 months. It was no time. I'm seeing here that it is not true. They were paid for the past 2 months. Guardian Media Limited.
Yes, Joshua Simongo here again. I wasn't too satisfied with the answer provided for my first question about citizens returning. The minister said the Prime Minister will address that, but my question wasn't about when the border should open. I'm asking if the minister, if he's confident that when citizens return, I mean, we assume they must return at some point, that the healthcare system would be able to manage with their return whenever they return.
Sure.
And if things are already being put in place for such an instance when they return.
Right. So it's a stepwise approach. So we are taking, as you've seen with the persons returning from Barbados, the persons returning from Suriname, that we're putting them into state quarantine. So that's our way to actually protect the rest of the population from getting infected. The the discussion of borders, as you have seen, as the risk increased internationally. So as we went from country to country, first the disease was in China, then it would have gone to different parts of the world, and we would have had closures of our borders to those countries that have had increased and sustained community spread. So when we are reopening, we have to look at, of course, considering that it may be phased in some form or fashion, but it will rely heavily upon the state of infection outside of Trinidad and Tobago. Who are returning, the people that are returning, there will definitely be some element of self-quarantine, as we have seen with the last 20,000 persons returning before the closure of the border. So there needs to be self-quarantine at home for 14 days of certain individuals. Of course, in the first instance, we might have to go down that road. The key to it is to prevent any incoming infections, imported infections, which will create a second wave from taking root in the country. So that's how we will manage it in a stepwise approach. But of course, it will be guided by the nature and the type of infection occurring in the other countries outside of Trinidad.
Thank you. At this time, I'd like to ask the Minister of Health to give us a final statement.
Thank you. Thank you very much, Minister Cox. Thank you, ladies and gentlemen of the media, for entertaining us again this morning. I just want to touch on 3 things to remind the country about, 3 or 4 things. Your parallel healthcare system, for the most part, is up and running. We want to remind the population to take advantage of the following. 1, make sure your young children continue to be immunized. We do not want outbreaks of childhood diseases like measles, mumps, polio, whooping cough. Please, parents, take your young children to be immunized. 2, we also want to remind persons with HIV/AIDS that your HIV/AIDS clinics are up and running. Please don't fall off your therapy because that will have some negative consequences. Keep on visiting, keep on getting your tests, keep on taking your medication. We are there for you in this time. And the third reminder is people suffering from chronic disease, diabetes, hypertension. This is a time for you to be even more vigilant with your medication. Our clinics are open, albeit on slightly adjusted schedules. Visit your clinics. Make sure all your chronic diseases are under control, that you are eating well, that you are exercising. And the fourth and last issue I just want to remind on is our homes for the aged and our nursing homes. I thank you for the cooperation you have been giving us so far. These are very vulnerable people that we have under our care and management. I am hoping that our policies, and I know they are being followed, and please pay attention to what Dr. Rampal has said this morning. We would like to have all these elderly around with us for as long as humanly possible. Lastly, I want to thank the country so far. Most of us have been responsible. Let us continue along that path, and together we will come out of this as stronger and better people. Thank you very much, Minister Cox.
Thank you very much, Minister. Thank you, doctors. Thank you, members of the media. We have come to the end of today's virtual media conference. Do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. As we continue to practice social distancing and follow the stay-at-home guidelines, we wanted to say thank you to all our essential workers who have kept our country going in these challenging times. Thank you for your commitment and understanding that your work is needed in the face of all the risks involved. To those who continue to stay at home, thank you for exercising restraint and protecting each other. By staying indoors and isolating yourself, your sacrifices have given Trinidad and Tobago the success it has achieved so far. Please let us continue to follow the guidelines of our public health officials. Let us not give COVID-19 the inroad it needs to affect our families, loved ones, and friends. Let us resolve to beat this virus. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to flatten the curve and beat COVID-19. Stay home, Stay safe. May God bless Trinidad and Tobago.